Welcome to the Caris Practice Joint Replacement Education video. Viewing this course in its entirety is a requirement for all patients who are planning on having a joint replacement procedure, as we find it to be extremely helpful in answering many of the questions you may have leading up to surgery. We are happy to accommodate patients who require disability paperwork to be completed for surgery. You can send us this paperwork via email, fax, or by dropping it off in person at our Harrison Street office location. Please allow us 7 days to complete all required documents. Our practice considers the day of surgery to be the first day of medical leave. We authorize up to 90 days in total, as Dr. Caris is devoted to fixing your joint and allowing you to return to all the things you love within this time frame. First and foremost, we'd like you to meet Dr. Caris, who will be performing your surgery. Dr. Caris is a board-certified, fellowship-trained orthopedic surgeon who specializes in total joint replacements. He is proud to have completed his undergraduate degree at Notre Dame prior to attending medical school at Rush University, where he was well known to the orthopedic practice. He was then accepted into the Distinguished Orthopedic Residency Program at Duke University Medical Center, where he spent the next 5 years. He completed an additional highly specialized year of training, known as a fellowship, back at Rush University Medical Center with Midwest Orthopedics, where he focused primarily on hip and knee replacement surgery. He then worked for 3 years at a private practice before returning to Midwest Orthopedics at Rush to provide top-level care to his patients in an academic setting. Dr. Caris takes pride in being surrounded by a hand-picked team of individuals who are dedicated to providing exceptional care to our patients. When questions arise, please reach out to our office directly via the phone number provided on this slide, and you will be connected with a team member who is best fit to assist you with your concerns. After surgery, you will be provided with an additional phone number specifically for orthopedic emergencies that must be addressed outside of our regular office hours. Orthopedics is a highly specialized field, and Dr. Caris has dedicated his career to focusing on total hip and knee replacement procedures. Knee replacement surgeries can be either total or partial. The type of surgery that is the best fit for you is determined during your comprehensive evaluation with our team, which includes imaging studies, physical exam, and the type of pain that you are experiencing. There is really only one type of hip replacement. However, this can be done via different approaches, most commonly either via anterior or posterior approach. We'll discuss this more in the coming slides. Many of our surgeries are performed using computer navigation, otherwise known as robotic assistance. These tools help with surgical planning to ensure we are able to achieve the best outcomes for our patients. However, it should be noted that Dr. Caris is the one performing the surgery, not the robots. Joint replacement surgery is a treatment option for patients who are experiencing significant pain from osteoarthritis. Arthritis causes a loss of cartilage, formation of bone spurs, and narrowing of the joint space, which then results in discomfort and greatly impacts an individual's day-to-day life. The images on this slide demonstrate what that looks like in a knee and a hip joint. The image on the left is a healthy joint, whereas the image on the right are a hip and a knee that are riddled with arthritis. For our patients who are scheduled for a knee replacement, our team has an ice machine kit available for purchase at our DME store. This kit is $49 and includes both the ice machine and compression stocking shown on this slide. If you are interested in purchasing this machine or have additional questions, please reach out to the phone number listed here. If you decide to purchase this kit, it will be provided to you prior to leaving the hospital on the day of surgery. The DME store also offers an orthopedic nutrition bundle for our patients before and after surgery. It is a protein system with shakes for 2 weeks before and after surgery. The idea is that the protein will assist in the recovery process in the form of muscle rebuilding and wound healing after surgery. This is an out-of-pocket cost of about $300. This is by no means required. However, if you would like to purchase this bundle, you may do so directly through our DME store for pickup at either our downtown or Oak Park locations, or via the 1-800 number if you would like it sent directly to your home. For patients who are not COVID vaccinated, our facilities require proof of a negative COVID test 3 days prior to your surgery. This can be emailed directly to our office. The primary phone number that you've provided to us has actually already been enrolled to receive text reminders before and after surgery. If you would like to enroll an additional device, you may do so by texting JOIN to 312-697-3895. If at any point you would no longer like to receive text message reminders, send FINISH or STOP. This is an automated text system and is not interactive. Various medications must be stopped prior to surgery in order to optimize your outcomes. We ask that you discontinue all over-the-counter vitamins and supplements 7 days prior to your surgery. Blood thinners including Xarelto, Eliquis, Plavix must be stopped a minimum of 3 days before surgery. For questions on specific medications, please refer to the prescriber of the medications directly for their recommendations leading up to surgery. If you fail to stop certain medications in accordance with our guidelines, you are at risk of your surgery being canceled. Unless otherwise stated, please continue to take all other medications regularly. Some medications may be held the morning of surgery. Most often, these are diabetic medications and water pills. For questions regarding which medication should or should not be taken the day of surgery, please refer to the recommendations provided by the internal medicine provider that cleared you for surgery. The day before your scheduled surgery, the team at the surgical site you are scheduled for will give you a call, typically between 3 to 6 p.m. If your surgery is on a Monday, this call will take place on Friday. They will update you on exactly what time to arrive to the hospital at, where to park, where to check in, and what to bring with you the day of surgery. We kindly ask that you refrain from eating or drinking anything after midnight on the day of surgery. One exception to this rule is 16 ounces of Gatorade, which we would like you to drink 2 hours prior to your arrival to the hospital or surgery center. Any type of Gatorade is allowed, including sugar-free, except for the red or the purple flavors. If you are taking any medications the morning of surgery, you may take them with a small sip of water. When preparing to leave for the hospital on the day of surgery, remember to bring your insurance card and a photo ID. Plan on wearing loose-fitting, comfortable clothing and supportive shoes for when you leave, so no slippers or slide-ons, please. If you have crutches, a cane, or a walker at home, bring them with you. If not, no worries. One will be provided for you before you leave and is yours to keep. Bring your cell phone and a charger, but leave all other valuables at home. Lastly, if whoever is accompanying you the day of surgery wishes to stay close by during surgery, they will be shown to a waiting room on the premise. If they prefer to wait at a nearby coffee shop or other local establishment, Dr. Karras will reach out to them via phone after surgery to update them on your status and signal that you are ready for them to return. All right, so far we've covered everything you need to know for before surgery. Now, we'd like to spend a bit of time going over some important aspects of the surgery itself. A separate section about anesthesia will be covered towards the end of this video. Most of our surgeries require about 60 to 90 minutes in the operating room. Typically, patients arrive at the hospital or surgery center approximately 2 hours before their surgery and will be in the recovery area for around 2 hours after the procedure is complete. That means that for our patients who are planning on going home the day of surgery, you will be there for around 6 hours in total. Many of our surgeries are robotic assisted. Pictured on this slide is one of the robotic systems that we use in the operating room for certain surgeries. As previously mentioned, Dr. Karras is performing the surgery himself. However, we use these robotic systems in order to help visualize where your bones and ligaments are in space, which allows us to better individualize your surgery to your very own anatomy. This aids in reestablishing your own biomechanics and ensuring that we are able to achieve the best outcomes for our patients after surgery. During your surgery, we will remove the arthritis in your joint by shaving down the bone, removing any bone spurs, and replacing each component of the joint with a prosthesis. Pictured on this slide are the components of a total knee replacement. For those of you who may be curious as to what your new joint is composed of, our knee implants contain a mix of titanium, chromium, and cobalt, as well as a piece of medical-grade plastic, which is known as polyethylene. This is a highly cross-linked, high molecular weight product, much different than the plastic that is found in stores. Our hip implants are composed of titanium metal only, with a ceramic femoral head and polyethylene plastic liner between the two pieces. When traveling after your joint replacement procedure, we recommend verbally alerting the TSA agent at your security checkpoint that you have had a total joint replacement. However, you will not require any additional paperwork. In most large international airports, you will not set off the metal detectors. However, smaller domestic airports may require you to use the body scanner instead, so it's best practice to give your TSA agent a heads up. This slide shows what each specific joint replacement looks like. On the left, you will see a hip replacement, whereas on the right, you will see the various types of knee replacements, with the total knee replacement being in the top left of that image, a medial unicompartmental replacement on the top right, and finally, a patellofemoral replacement on the bottom. For all of our patients undergoing a knee replacement, we require some additional x-rays in order to assist our surgical planning for your procedure. Here you will see an example of standing films that show us the alignment of the hip, knee, and ankle. In this example, the patient has lost cartilage and joint space in the inside of their knee joint. Obtaining this set of x-rays allows us to visualize how best we can restore your knee in order to correct the alignment from your hip all the way down to your ankle. Let's talk incisions. Traditionally, knee incisions for a joint replacement were between 8 to 10 inches long and cut through a larger portion of the quadriceps muscle, making recovery for patients more challenging. Dr. Karras uses a more minimally invasive approach, which ends up being about 6 inches long on the inside of the kneecap. The approach that he uses respects the soft tissues while also allowing him enough space to incorporate robotic assistance into the procedure, all of which aids in allowing a speedier recovery for our patients. Surgical planning for our hip surgeries requires an additional set of x-rays as well as a CT scan. This allows Dr. Karras to be able to obtain certain measurements that he uses to ensure proper leg lengths and so that the implant grows properly into the bone. We then utilize the CT scan as a part of the computer navigation system used during surgery. The primary incision for our hip surgeries is located towards the back of the hip or posteriorly. This is about 6 inches in length. There is a smaller 1 to 2 inch incision on the front of the hip or anteriorly, which is where the robotic array is placed during surgery. Postoperative care and dressing changes will be covered in depth on the paperwork that you receive after surgery. However, we will briefly address these topics in the following slides. After surgery, you may shower right away. Just let the warm, soapy water run right over the incision. You may place an ABD pad over the incision for comfort. However, this should be removed prior to showering, as this type of padding is not waterproof. We ask that you avoid baths, swimming pools, hot tubs, saunas, and steam rooms for the first 6 weeks after surgery. During this time, we also ask that you avoid putting any topicals, including moisturizers or scar creams, directly over the incision. For those of you who may have fluffy friends at home, please try and keep them away from your incision for the first 6 weeks after surgery. While there are many different types of ways to close an incision after surgery, all of our patients will have dissolvable stitches underneath their skin. Some of our patients may also have external stitches, which will be removed at the 3-week post-op appointment. We do not use staples on any of our incisions. Pictured here is an Aquacel dressing. This is a waterproof dressing that is placed over patients' incisions who have external sutures. This should stay on for 7 days, at which point it can be removed and discarded. Once removed, you may continue letting the soapy water run right over the external sutures and pat them dry once out of the shower. The sutures will be removed at the 3-week post-op visit. It's typical for there to be some redness around the incision after surgery. Bruising is also common after surgery, especially in knee replacements. This can occur both above and below the knee, not just around the incision, and often moves around quite a bit in the first few weeks after surgery. Bruising can also occur after hip replacement surgeries. Due to gravity, swelling and bruising can often occur much lower on the leg, even down to the foot and ankle, so don't be alarmed if this happens. Everyone is different. Some people bruise more than others. If you're someone who bruises easily, prepare yourself for this to happen after surgery. This is a great visual of how a bruise heals. Rest assured, it is completely normal for a bruise to get worse before it gets better. After surgery, our goal is to get you up and out of bed. You will be asked to sit up and dangle your feet over the edge of the bed, get up and walk around with a physical therapist, and try going up and down some stairs. Once you have been cleared by a physical therapist at the surgery center or hospital, you are considered medically safe to go home. It is ultimately up to both the medical team and the orthopedic team to determine when you are ready to be discharged by the hospital or surgery center. With that being said, you should have an idea of whether or not you are going home that same day or staying overnight, which was likely determined and discussed when you signed up for surgery. Our goal is to get you home to the comfort of your own bed. We do not support patients going to short-term rehab facilities after surgery, as the best recovery takes place in your very own space. Our team of physical therapists work closely with our practice. However, they are a different department and will reach out to you individually in the days leading up to surgery in order to coordinate care. We typically have physical therapy come into your home for the first 2 to 3 weeks after surgery. Once you have met your goals with them, they will assist you in transitioning to physical therapy in a more traditional setting. We try our very best to get therapists into your home after surgery. However, there are some circumstances in which this is just not possible. If we are unable to do so, we will let you know as soon as possible so that you are able to plan accordingly. After surgery, we really want you to focus on the acronym RICE, or rest, ice, compression, and elevation. For the first 7 days after surgery, you should limit your activity to about 5 to 10 minutes once every hour. Ice should be applied for 45 minutes at a time with 2 hours off in between. Compression socks should be worn by all patients for 3 weeks after surgery. For our hip patients, you should also wear a tight pair of boxers or bike shorts for additional compression around the hip. Elevate your toes to your nose regularly after surgery to reduce swelling. You will swell after surgery. Ice and elevation will help with these symptoms. One of our team's top priorities is to help our patients get back to doing all of the things that they love. As Dr. Karras likes to say, we don't save lives, but we do save lifestyles. We would love to see all of the amazing things that bring a smile to your face after surgery. You can send photos of you making the most of your joint replacement to karraspractice@rushortho.com. We would love to include you in our joint replacement family album. You may even be featured on one of our social media sites. Some common medications we utilize after surgery are included on this slide. Oxycodone instant release is a fast-acting narcotic medication that is provided to you after surgery and should be used on an as-needed basis for pain. Oxycodone can be taken up to every 4 hours as needed. However, many of our patients never require the use of this medication as their pain is adequately managed via our other medications. With that said, we recommend you take an oxycodone before bed the first night to help with sleep and that you hang on to this med so that you may use it as needed for physical therapy or other times of acute pain that surpasses about a 5 to 6 out of 10 despite the use of your other medications. High-dose Tylenol and Tramadol are the mainstays of our pain management plan for surgery. These medications are scheduled in the morning, afternoon, and evening in the first few weeks after surgery. This allows a small amount of the medication to be at a constant state in your body in order to help reduce pain after surgery. When you feel as though you are ready, you may begin reducing the amount of Tramadol you are taking in the first few weeks after surgery. Meloxicam is a prescription-strength anti-inflammatory that is extremely beneficial in reducing swelling and scar tissue formation. This medication is known to be a bit hard on the stomach, so we recommend always taking it with food. We also will have patients taking Protonics while they are taking meloxicam in order to further protect the stomach. We ask that you remain on the meloxicam for 90 days after surgery unless otherwise stated by a member of our clinical team. Lyrica or Neurontin are medications used for nerve pain reserved for patients under the age of 70. This is because these medications are known to cause confusion in certain patient populations, especially in combination with other daily medications. Most of our patients will be on a 28-day course of aspirin after surgery to reduce the risk of blood clots after surgery. If we would like you to be taking a different blood-thinning medication for this same reason, we will discuss that with you during your pre-op phone call. Lastly, Senecot is a stool softener that we have you take daily while taking Tramadol and/or oxycodone. Constipation is common after surgery for many reasons, including the medications you're taking, reduced activity, and changes in diet. This should help with that. Nausea after surgery can occur for many reasons, including decreased appetite, medications, anesthesia, or from the stress of surgery. Another medication provided for you after surgery is Zofran, or ondansetron, which should be used as needed for nausea. Let the medication dissolve either in your cheek or under your tongue. Other recommendations if you are experiencing nausea after surgery include sticking to a bland diet, for example, bananas, rice, applesauce, and toast, use of stool aids, chewing gum, and simple tummy rubs. Let's take a moment to talk about risks. Any medical procedure a patient undergoes will have some risk of complication. Our team is dedicated to ensuring we take extra precautions to minimize risks as much as possible. However, there are a few potential complications that we should talk about and we'll be discussing on the upcoming slides. The potential risk for hip and knee surgery are very similar. These risks include blood clots after surgery, blood loss, infection, implant loosening, bone fracture, leg length discrepancy, and more so for hip surgeries, a risk of dislocation of the joint. Now let's break down each of these a bit further. Blood clots are a serious complication that can occur following an orthopedic surgery. The risk is less than 1%, however, we take extra precautions to minimize this risk as much as we are able to. These measures include having all of our patients on a blood thinner for 4 weeks after surgery, ensuring that we are able to get you up and moving very quickly once your procedure is complete, which is possible due to our minimally invasive approach, and having patients wear compression stockings on both legs for at least 3 weeks after surgery. Signs of a blood clot that we would like you to keep an eye out for include constant calf pain and swelling that does not improve with compression, ice, and elevation. In rare instance, a blood clot can move up to the lungs, at which point it is considered a pulmonary embolism, which is a medical emergency. If you develop chest pain or shortness of breath, please immediately call 911 rather than our practice's emergency line. Another potential risk during surgery is injury to the nerves that are responsible for the function and sensation of the foot and big toe. This also occurs in less than 1% of patients, and Dr. Karras does a very good job at respecting the soft tissues and protecting the surrounding nerves. If this complication were to occur, we would know immediately after surgery. This is not something that develops over time. We ask you to wiggle your toes and ensure you can feel when someone is touching your foot after surgery to assess that your nerves are still intact. Injury to the nerves can be either temporary, which results due to anesthesia and will resolve over time, or permanent if the nerve is severed entirely. While damage to major nerves is extremely rare, superficial nerves that run along the incision are always impacted during surgery. Nerves are slow to recover, and this can lead to numbness and nerve pain. For patients under the age of 70, we include a medication that acts specifically to reduce nerve pain. Arthritis causes weakened integrity of your bones, which leads to a risk of fracture both during and after surgery. If a fracture were to occur during your surgery, this would be fixed immediately, and we would update you on your weight-bearing status as needed. After surgery, we ensure that you are appropriately fitted with assistive devices to help you get around. However, falls do sometimes still occur. Typically, falls do not affect the implant, but they can potentially injure the surrounding structures in the joint, including damage to soft tissues or fracture of surrounding bones. If you are able to get up immediately following a fall and bear weight onto the joint, you are likely just fine. If you have difficulty getting up, bearing weight, or are unable to move the joint, please seek further medical attention and update us on your status as soon as possible. Infection can occur in the replaced joint at any point after surgery. Your lifelong risk is around 2 to 3%. This is why we have you stop any invasive procedures 3 weeks prior to your surgery, and we ask that you hold off on returning to these procedures for at least 3 months after surgery. Signs and symptoms to look out for if you are concerned about a possible infection include severe redness and swelling around the incision, pain that is not explained by PT or other activities, which usually translate as difficulty walking due to severe pain, fevers above 101.5 degrees Fahrenheit, and new drainage from the incision. If you are experiencing these symptoms, please call our office to update a clinical team member so that we can determine appropriate steps for you moving forward. Monitoring for infection is so important because if it does occur, this automatically means you will require another surgery. We must take you back into the operating room and open up your incision so that we can wash out the infection and replace the piece of plastic to ensure the bacteria is removed from the joint. We then consult with infectious disease and have you receive a special IV called the PICC line so that we can give you IV antibiotics for at least 6 weeks. After 6 weeks, we have you transition to oral antibiotics until infectious disease feels as though they are no longer needed. This is a big deal in the joint replacement realm. As much as we wish we could prevent this entirely, it does sometimes occur, so we need to make sure that you are aware of what to look out for so that we can address this as soon as possible. We take a number of precautions to minimize the risk of infection as much as possible. We give you antibiotics before, during, and after the surgery while you are in the hospital. The OR is designed to reduce the risk of infection by producing laminar airflow and by being kept cold to reduce the chance of bacterial growth. Our team also wears double gloves and special body exhaust suits that further protect you during the surgery. You've likely heard us refer to invasive procedures by now. This includes any type of procedure that interferes with your skin barrier and results in a cut or open wound. Examples of this would include dental cleanings or other dental procedures, dermatology procedures, cataract surgery, and anything that includes a scope, such as a colonoscopy. We ask that you refrain from having any procedures done for 3 weeks before surgery and for 3 months after surgery. After 3 months, our team will prescribe you a one-time dose of antibiotics that we ask you to take 1 hour prior to any invasive procedure. This will occur for 1 year after surgery. Once you hit the 1-year anniversary of your surgery, we no longer require antibiotics before these procedures. Just to reiterate, we ask you to take an antibiotic 1 hour prior to any planned invasive procedure. We do not require a daily antibiotic after surgery. We will provide the antibiotic for you beginning at the 3-month post-op appointment and only require antibiotics for 1 year following your surgery. Knee procedures come with an increased risk of stiffness after surgery. We want you to have an appropriate range of motion, which is accomplished through use of anti-inflammatory medications and physical therapy. This is one of the reasons it is so important for you to follow your prescribed medication schedule and be diligent about physical therapy, both with your therapist and on your own via home exercises given to you. If we are concerned that you are not achieving appropriate range of motion in the joint, we may discuss a closed knee manipulation under anesthesia. In this case, we would have you come back into the operating room so that we can put you under anesthesia for adequate pain control and then physically manipulate the joint to break up scar tissue and achieve increased motion in the joint. While hips don't tend to get stiff, they do come with an increased risk of dislocation. If you were to dislocate, you will experience significant pain, you will be unable to bear weight, and you will note that one leg is shorter than the other. This usually occurs as a result of trauma. If this does occur, it is considered an orthopedic emergency and requires you to call 911 and be evaluated and treated in the emergency room. Please update us after you have been evaluated by a medical professional. Measures we take to minimize this risk include having you follow strict hip precautions for 6 weeks after surgery. This means no twisting at the waist, no crossing your legs, and no bending at the waist past 90 degrees. Your physical therapist will also go over these precautions with you. I know we just threw a lot of information at you. If you have any follow-up questions or questions that were not answered in this video, there are a few additional resources that we have available. You can refer to our website, carismd.com, for answers to many frequently asked questions. Jot down any additional questions you have and discuss these with the clinical team member who performs your preoperative phone call. After this phone call, you will be given access to your discharge instructions that go over important information to know for after surgery. If answers cannot be found in these additional resources, you may call or email our office during office hours, which are Monday through Thursday from 8 to 4 p.m. and Friday from 8 to 3 p.m. For urgent orthopedic concerns that cannot wait until the next time our office is open, you will receive our emergency practice line after surgery. This line will connect you to a member of our clinical team. We kindly ask that you refrain from utilizing this line for refill requests in regards to appointments or for paperwork requests. In cases in which you are experiencing a true medical emergency, you should immediately contact 911 and update our team once you have been evaluated by the appropriate medical professional. As you may already know, Rush is an academic institution, so you may be contacted by a member of our research teams that work closely with joint replacements taking place in our organization. We highly encourage you to learn more and consider taking part in these research studies to help us make further advances in medicine so that we can continue offering the most up-to-date, top-level care for our patients. These studies do not interfere with any of the drugs given during surgery, and Dr. Karras ensures participation in research studies do not interfere with his ability to provide care in favor of what's best for our patients. Participation at the end of the day is entirely up to you. In order for us to complete your surgery, we work closely with a phenomenal team of anesthesiologists at all of our surgery locations. We'll discuss a bit about anesthesia in the coming slides. However, we would like to note that you will have the opportunity to speak with a member of our anesthesia team prior to surgery. Any anesthesia-specific questions you may have will be best answered by the team who handles this aspect of surgery. Our preferred method of anesthesia is combined spinal epidural. You will receive IV medications that put you to sleep and separate medications that make your legs go numb. We prefer this over general anesthesia due to the many adverse effects of general, which can include severe nausea and vomiting, respiratory complications, and forgetfulness. Rest assured, no matter what, you will be put to sleep during surgery. Upon waking up from anesthesia, you may feel groggy and cold as the ORs are kept at a very cool temperature. Your legs may be numb. As the anesthesia wears off, they may begin to feel heavy. This is normal. Your post-procedure team will continue to check up on you to ensure that you are progressing appropriately and that your pain is well controlled as you transition out of anesthesia and onto your oral pain medications. Congratulations! You have made it to the end of our teaching video and are now one step closer to receiving your brand new joint. Thank you for hanging in there. I know this was a lot of information, but we feel as though it is important for you to be aware of as you prepare for your surgical experience with our team. The following slides contain a short quiz so that you can test your knowledge and reinforce some very important aspects of this video. We want you to know that we are here for you every step of the way. A member of our clinical team is looking forward to speaking with you further during your pre-op phone call and will be happy to answer any additional questions you may have prior to surgery. We are so glad that you have selected our team to support you in this journey to getting back to doing all of the things you love.